your time today. I apologize. I'm getting over COVID, unfortunately. So, but all is well. I just still have a remainder of a cough. And so if I take a couple drinks or coughing fits, that's why. Thank you so much for joining me today on this hot day for both of us, a little hotter for you. I'm Megan Ockett. I'm the program director with Healthy Birthday. I'll go into my background here in a minute, but first, I want to give a couple housekeeping updates and a shout out to the Alabama Department of Public Health. It's because of a partnership with Samil and her team, and that we are here, that we and Crystal Lee for bringing us there and talking about us, and Samil saying, yes, let's do this. So Count the Kicks is a national organization, but we're based in Iowa. So I'm in Iowa, the whole team is in Iowa, but we all kind of work virtually anyways nowadays. So super excited to be in Alabama. You might have heard this presentation before. If so, there's a couple new updates. So hopefully you learned something new. If this is the first time of you hearing this presentation, I hope you learn a lot and you walk away energetic and inspired and confident in how to talk about stillbirth and stillbirth prevention. And so with that, I want to let you know you will get a PDF of the slides after the presentation. You'll also get access to the recording so you can share it with any of your team members that might not have been able to join. And I'll send an email after with a couple other links that we'll talk about here today. Go ahead and ask questions in the chat as we go, and then I'll answer them at the end. But I'd like you to ask them just in case you forget them, and just ask them as you think of them, and maybe they'll get answered as we talk. You can also use the Q&A function, but again, I'll answer all questions at the end. I'm going to turn off my video for the majority of this, only because I have some videos that play, and we're just Wi-Fi broadband issues. So I'm going to go ahead and get started. So again, my name is Megan Ockett. This is my contact information. Please use it, email me, ask me questions later. I love hearing from you all because you're the boots on the ground. You're the ones that are taking this information and you're the ones implementing it. So I want to make sure what we're doing is exactly what you need and making sure that we're meeting your needs. And I love hearing from you. I love hearing that it's working. I love hearing thoughts and ideas. And so please contact me. My background is in public health. I have over 13 years of experience in public health. My true passion is maternal and child health, and especially around prevention and education. So you'll hear me talk a lot about this empowering campaign, but you'll also hear me talk about how to integrate this into your workflow, because I love systems change. I love policy change. I love finding ways to integrate Count the Kicks so that it's easy for you to remember. It's easy for you to talk about. It's not difficult, knowing how difficult stillbirth can be and sad, but it's giving you the tools and resources to be able to talk about stillbirth, just like you talk about the importance of lying a baby on its back to sleep. So that's what I hope to do today. And before I start, I'd like to share a video, and I share this video for a couple of reasons. One, it's a feel-good story, so it'll bring a smile to your face. This is about Baby Save Ruby. And when I talk about baby saves, what I'm talking about is those babies that their parents have contacted us and said, I was using your app and I noticed reduced fetal movement, or I spoke up to my provider, I knew about Count the Kicks, and my baby's here because of it. I knew something was off, I spoke up, and now my baby's here because of you, because of Count the Kicks, because I was told about it from a home visitor, because I downloaded the app when my WIC consultant was talking to me about it. I'm here because of it. Those are our baby saves. So we have close to 100 on our website, but we know there's so many more out there. This in particular, I share for a couple reasons. Like I said, it brings a smile to your face, but two, if you're not that familiar with Count the Kicks, it does give a good overview of how it works and how the app works. I also share it because I might reference it a couple times throughout the presentation. And then I also share it to highlight the importance of storytelling. When this aired on Good Morning America, we saw a 3,700% increase in our app downloads. We saw such a spike, and it really spearheaded this entire campaign. Anytime you have the opportunity to share these videos, to share these stories, and we have countless more on our website, do so. Can you share them in waiting rooms? Can you share them on during meetings? Say, watch this video, because I guarantee you today when you leave and you go back to what you're working on, you're going to remember baby Ruby, and you're going to remember baby Nala, who we're going to share at the end of the presentation, because that's what we want. We want you to remember these so that you remember that it's important to talk about Count the Kicks. And this is why we do this. So let's watch.
We're going to turn now to that GMA parenting alert about a free app. A mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So yeah, hopefully brought a little smile to your face. So we'll talk a little bit more about that later on, but I think it was just a good starting video to kind of get us started off. So Count the Kicks, if you didn't know, is an evidence-based stillbirth prevention public health campaign. It's truly an early warning system for expectant parents. You're educating birthing people on the importance of tracking fetal movement through the use of our app, which we'll talk about here in a couple slides, or we have paper charts available as well. One of the things I love most about this is it's empowering. If you look at the materials, it's bright, it's colorful, it's empowering expectant parents to speak up to providers if there's a concern. We know that 1 in 3 at-risk babies can be saved with Count the Kicks because that's what we're doing here in Iowa, and that's what we want to do in Alabama. Oops. So before we go too much further, I just want to make sure we're all on the same page. And I think we all are based on the comments of where you all work. But I think it's important to make sure that we have the same terminology. And so today we're talking about stillbirth, and stillbirth is the loss of a baby after 20 weeks of pregnancy. Stillbirth's further classified as either early, late, or term. And on average, 23,500 babies are born still every year in the United States. And then infant mortality is death of an infant before his or her first birthday. On average, around 22,000 infants die every year in the United States. And then miscarriage is usually defined as the loss of the baby before the 20th week of pregnancy. And so what I want you to take away from this slide is the fact that we're losing just as many babies, in fact, slightly higher to stillbirth than compared to infant mortality. And that's not to underscore the devastating tragedy of infant mortality and the death of an infant before his or her first birthday. What I want to do is raise your attention to the fact that we're losing just as many babies, but we're not talking about stillbirth like we're talking about infant mortality. We need to be having this conversation, just like we're having a conversation about laying baby on its back to sleep, having a fan circulating the room, not smoking around baby. We need to be having the stillbirth prevention conversation just as often as we're having the infant mortality, the SIDS prevention conversation. And that's what I want to do today. I want to give you those tools and resources of how to have that conversation so we can get away from this taboo topic and start being able to talk about stillbirth and stillbirth prevention with expectant parents. Some of the causes of stillbirth and contributors identified in this study were things like pregnancy and labor complications, problems with the placenta, birth defects, infection, problems with the umbilical cord, and medical complications in the mother. We don't go into the causes of stillbirth. We're talking about prevention today, but I always like that slide and that research link there as well. And so you heard me say that 23,500 babies every year in the United States are stillborn. That's 65 babies a day. That is like a busload of kindergartners, a busload of kids every single day in the United States. It's a lot more prevalent and common than people think. 1 in 169 pregnancies ends in stillbirth across the United States. And the racial disparities are huge. For Black women, it's 1 in 96. Black women are 2 times, sometimes 3 times, depending on the state, more likely to experience a stillbirth over white women. Hispanic Latinx moms, it's 1 in 199. Indigenous moms, 1 in 138. Again, depending on the state, that might be higher. White women, 1 in 204. Asian Pacific Islanders, 1 in 233. Families are 10 times more likely to lose a baby to stillbirth than to SIDS. So if we take a little bit closer look at your Alabama data specifically, the stillbirth rate is 8.85 per 1,000 live births. That's a 5-year average. That is the highest, if not the top 2, I think, highest in the nation. 1 out of 113 pregnancies in Alabama's ends in stillbirth. You're losing approximately 527 babies to stillbirth every year in the United States or in Alabama. And so in this graph, you can see the data here, Alabama, you're in yellow, Iowa's in red, and then the national line. So what we want to do with this campaign and this partnership is we want to get you down to the red bar, our bar, or even lower, because we have a 32% reduction here in Iowa since the inception of Count the Kicks, which I'll talk about here in a minute. And then again, if we look at those race disparities that exist and persist, you can see it's double, sometimes triple, depending on the year of your Black fetal death rate. So we're really excited by this partnership because in the first 5 years of our campaign here in Iowa, we saw a 39% reduction in the number of stillbirths among Black women. In the first 10 years, 2008 to 2018, so in that decade, there was a 32% reduction of number of stillbirths in Iowa. And so we want to bring this 32%, that's what I mean when I say we're saving 1 in 3, that 32% reduction to Alabama. That's our goal. And that's why we're having this conversation today. So you can see in 2021, we're back down to that lower, that 3.9, that 4, the second lowest on record, and this chart here. And that's what we want to maintain. It's really important to look at stillbirth trends over time, those 3 to 5 year averages. So what I want you to pay attention on this slide is that dash line, that downward trend line. There has been nothing else going on in Iowa that would have made such an impact on the stillbirth rate. That's what public health officials have told us. We're doing a research study on it right now. There wasn't like every pregnant person got a doula care, which would be amazing and we know would have positive impact. It's not like smoking and obesity rates decreased. In fact, those increased. Those are risk factors. So while all of those risk factors are increasing, we're still decreasing our stillbirth rate because of Count the Kicks. And that's what we want to do in Alabama. So why are there such large disparities that exist and persist in stillbirth? So research shows that there's a lot of contributing factors, racism being number 1 on the list, systemic racism, toxic stress. Research shows that years of being treated unequally and or unfairly, essentially being an African-American woman in a systemically unjust society, and everything that comes with it has led to real and pervasive health issues for Black women. Predisposition to certain conditions that may lead to stillbirth, like gestational diabetes and high blood pressure, all are linked to maternal stress, and experts say Black women are less likely than other races to receive early treatment for these conditions. Access to healthcare, socioeconomic barriers. Research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. So what are we doing to work to reduce disparities in stillbirth? What can you do to help work to reduce disparities in stillbirth? We're working within marginalized communities. We're working outside typical healthcare settings. We have an app in 14 languages, culturally appropriate educational material. We have health equity coordinator, soon to be director on staff. We're going to have 2 new positions opened. We have a laser focus on equity and inclusion. We're always looking for funding opportunities to reduce racial disparities that persist in stillbirth. We're an inclusive organization with 100% board and staff trained on anti-oppression and structural racism. We're improving programming based on the lived experiences of women of color. We have videos, printed education materials, and FAQs in multiple languages. Those are just a few of the things that we're working on that I think you could also take. Things like those trainings, those equity inclusion trainings would be great for you and your team to take, and things like that. Making sure that you have representation in materials, everything. So now that we have the data, you know about the data, you know where your rate stands in Alabama. Let's talk a little bit about the research behind this campaign, because that's always my #1 question is, how is this research? How is this evidence? Isn't this going to increase anxiety, et cetera? I'm going to address all of that right now. So this is the journal article that started it all, this reduction of late stillbirth with the introduction of fetal movement information and guidelines. That is a mouthful, as are all journal articles. If you like really reading journal articles and you love research, we have a whole webpage dedicated to you. We have a page on our website titled Evidence. Go check it out. There's tons of articles on there that all point to the importance of tracking fetal movement in the 3rd trimester and why we should do it. If you don't like reading pages and pages of journals and research, that's okay too. But I highly recommend, if you just read one, I want you to read this one, the one that started it all. So this study was based out of a study from Norway. And what happened was this cohort of expectant parents, when they were educated on tracking their baby's movement in the 3rd trimester, the stillbirth rate decreased among this cohort of women around 30%. So what happened was our founders, who are all 5 Central Iowa women who all experienced stillbirth or infant loss in the early 2000s, they were at a public health conference and they heard this presentation and they heard this project, this research that went on. And when they saw that there was a 30% reduction in stillbirths, they said, wow, we can do this. We can bring this back to Iowa. We can look at additional research. We can work with Iowa Department of Public Health and create this stillbirth prevention kit counting campaign. And that's exactly what they did. They came back to Iowa. They worked with other research and other data and articles and Iowa Department of Public Health, and they created what you all know today as Count the Kicks. Their goal was to save 1 baby back in 2007, 2008. If they could just save 1 baby, their goal in honor of the daughters that they lost would be met. And here we are over 10 years later, saving countless babies, families, parents from the loss of a child to stillbirth. So Dr. Ruth Fritz, she was one of the researchers on this Norway study. She is also part of our medical advisory board. And she said, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change. And so you're going to hear me talk about that normal movement pattern several times. So pay attention to that, because that's what's really important. That's a big takeaway. Some other evidence and research that I wanted to share is that the Association of Maternal Child Health Programs, AMCHIP, they do a whole scientific review of different projects and excuse me, things like that. How we engage stakeholders, our equity lens, everything like that. And they named us the best practice in 2021. The CDC Hear Her campaign, which I'm sure you all have heard about, as part of their CDC Hear Her campaign of 15 urgent warning signs, they list baby's movement stopping or slowing down as one of the key markers to watch for. And then probably my top question that I get asked is, especially among providers, nurses, midwives, is this is just going to increase anxiety. I'm not going to tell my patients about this. This is just going to have them all calling me. And, I understand their concern, but I'm here to say that that does not happen. This does not increase anxiety in most pregnant women. This study here stated that one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in the hospital. However, most research has not found this type of increase to be true, and usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. Because now what happens is you have an educated expectant parent with data in their hands that says, I know my baby's normal. So I know when I need to speak up. I know how to speak up. I'm going to show them my app or my kit counting chart because I've been tracking regularly. So we have also done our own study of our app users, thousands of app users. Des Moines University and the Harkin Institute did this research for us and found that 84% of app users stated that regular tracking was associated with feelings of bonding. They could focus on baby, they could include significant others, they could include siblings, and that 77% of app users reported feeling less anxious. The researchers also stated that using a mobile health app to empower mothers to monitor their baby's fetal movement, preliminary research shows the mobile health app increased awareness of a change in fetal movement and a reduction in stillbirth. I think there's other benefits that people tend to overlook or not think about. Things like, it can help reduce preterm birth rate, which I know we're all working on. Fetal growth restrictions can be identified earlier. It's when you go in with a change in fetal movement, it's not like baby has to be born right away, right? There's things that are checked. There's NSTs and biophysicals to see what's going on. They might find that babies, you're in labor and they need to stop contractions, and maybe you're put on bed rest for a couple weeks and you have a baby at 40 weeks like planned. That's exactly what happened to our executive director. So things like that. And then I think it's also important to note that women who have stillbirths are at substantially higher risk for severe maternal morbidity than women who have live births, regardless of the cause of fetal death. So due to the low cost and potential benefit, this researcher says it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. It's that check for baby. It's how baby's communicating with the expectant parent. So if something's not working, if they're not moving correctly and their movement changes, you need to contact your provider so they can see what's going on. So you heard me just mention that there's a connection between stillbirth and maternal mortality and morbidity. Because of this strong connection, we worked with additional researchers to create this white paper that is on our website. You can scan this QR code. It will take you directly there. I'll also send it in the follow-up, but some key things that I wanted to point out on this page in particular showed that research shows that the risk of severe maternal morbidity is more than 4 times higher among stillbirth deliveries compared to live births. And according to one study, more than 15% of maternal deaths within days of delivery occur in women who experience a stillbirth. So think about it. If we have the potential to prevent stillbirths, preventable stillbirths, could we also prevent moms from dying, the maternal mortality? Will we see that decrease in maternal mortality morbidity when we implement Count the Kicks like it's been implemented in other places? That is our hope for Alabama, and that's why we're here today. So again, it's evidence-based stillbirth. It's that early warning system. So why do movements matter? Movement is one very important way a baby communicates before birth. A change in baby's movements can be an early sign and sometimes only warning sign that baby may give when in distress. So it's really important to understand what's normal for your baby in that pregnancy. There's 3 types of movement change that I want to address. Baby has fewer or no movements. They slow down. Obviously, immediately call your provider. Baby may move, but movements are softer or weaker. Again, call your provider. If you think back to baby Ruby's story, where her mom said her movements just felt weaker. They felt softer. They didn't feel the same strength. That's strength. And that's what we monitor on the app as well, that we'll talk about in a minute. And then the third one is a sudden wild surge of movement can also be an important sign of distress. And so when you're talking to expectant parents about movement, what you really want to stress is you want them to know what's normal for their baby. So they can be counting daily around the same time and say, oh gosh, I always get 10 movements in 15 minutes. And today I got 10 movements in an hour and 20 minutes. That's not my baby's normal. My baby's normal is 15 minutes. They're going to notice that change right away. They're going to say, that's not my baby's normal. I'm going to call my provider no matter what time of day and night and see what's going on. For the sudden wild surge of movement, that is one that what research and lost moms have pointed to is it's almost an aggressive movement. It's not a normal strong movement. It's very, very wild. It's like a surge. It's kind of how it's been explained. So that would be another thing that if it's not, again, their baby's normal movement, they need to speak up to their provider. Excuse me. When should a mom start counting? We want people to start counting at their third trimester, so 28 weeks. If they are considered high risk, we want them to start at 26 weeks. This is really when research has established a baby is in a consistent pattern that mom can feel and track. So a common question is, work out the kicks. Is it just kicks? It's every movement except hiccups, those rolls, those jabs, those pushes, anything except hiccups, because hiccups are involuntary, so they do not count towards the movement count. So how do you do this? It's so simple. Count the kicks can help you be in tune with your baby. So this is how you could explain it to your expectant parents. I want you to start tracking your baby's movements. There's this free app called Count the Kicks. Let's go ahead and download it right now. If you're working with somebody who doesn't have a smartphone or doesn't always have access to Wi-Fi routinely, we have kick counting charts on our website, and really stressing how you really want them to count every day. That is imperative. You want them to count daily around the same time. So choosing a time when baby's most active, maybe it's 3 o'clock in the afternoon, maybe it's first thing when you get up. Research says evening is the best time, that babies tend to be more active in the evening. I wouldn't get too hung up on that, only because I know people work multiple shifts. I want it to work for them. I want them to choose the time baby's most active that works with their schedule, that they have time to sit down and focus on baby. So what they want to do is they want to time how long it takes baby to get to 10 movements. And after just a few short days, they're going to start seeing the pattern. The app will show them the pattern, but they'll also notice the pattern even if they're not using the app. So they're going to start figuring out the average amount of time it takes baby to get to 10 movements, and continue tracking every day and call their provider or their nurse line or go into the emergency room or the hospital. If you're in a rural area and they're in a maternity desert and they have a 60-minute drive, they can't wait for their family physician to open up the next day. They need to go in and get checked out. Hours and minutes can matter when it comes to this. So making sure that they get checked out if their concerns, making sure their concerns are heard, and that they go into their provider if they feel there's a change in movement or the strength of those movements. So now one of my favorite parts of the presentation is, as a presenter, I get to say, please take out your phones, because I want you to download the app. I want you to multitask right now, because we're in the United States and we can all multitask. I know it, you know it. So please take out your phones. If you haven't already downloaded the app, go into your app store and download it. And I want you to do this because, like I said, you guys are the grassroots. You are the ones that are going to be talking about this with your expectant parents, with your families, with your community. I want you to be able to say, look how easy this is. I downloaded it yesterday and I've already been using it. You can make up pregnancy profiles. I have about 20 in there because I'm always using it. I want you to see how user-friendly this is. I want you to be able to use it to show what the families you serve. So a couple of features that I really want to highlight while you're taking a moment and multitasking and listening is it's available in 14 languages. So if you work in a demographic and you don't see a language that you serve on the screen, let me know. We can always work with the state. We can look for grant opportunities, because like I said, we want to meet your needs and the needs of your community. So we want to make sure we're as inclusive as possible. So if you need a language on there, let us know and we will figure out how to make that happen. It's completely free. There are no ads. There are no pop-ups other than a daily message that's informational that we create that comes after their kick session. You can restart a session or delete a kick. So let's say how it works is you are ready to start counting. It's, let's say my baby's most active at 2 o'clock in the afternoon. I have a break between work hours or something like that. And I'm sitting down, I'm focused on baby. So when I feel that first movement that I want to start with, I tap that footprint. As soon as I tap that footprint that you see on the screen there, a timer will start. That footprint, I tap that footprint every time I feel a move, a jab, a push, a roll, until I get to 10. Once I get to 10, the timer stops. And what happens is it shows you a graph like you see on that image. it will show them after a couple sessions, the average amount of time it takes baby to get to 10 movements. So you can see it's a very visual representation of how baby's been moving. So for this baby in particular, the average time takes about 15 minutes and 24 seconds. So you can see there each session that user has done take around 15, 17 minutes, 16 minutes in there. Pretty linear graph, pretty average, you know, for that baby, that's their baby's normal movement. So let's say I'm counting and I'm this user here. And like I said earlier, it took an hour and 15 minutes or an hour and 20 minutes. What's going to happen to that graph is it's going to shoot up. So there's going to be a sharp increase in that app. So it's going to be a visual cue for me as a user to say, whoa, wait a minute. That's not my baby's normal. My baby's normal is 15 minutes or 16 minutes, not an hour and 15 minutes. I'm going to call my provider and see what they want me to do. And then that's how it works. It's that simple. One very key thing that I want to stress is that you can set daily reminders on the app. The app does set reminders itself, like it will say, oh, it's been 24 hours since your last kick, session. But I think it's really important for the user to set their own daily reminders. They can do it within the app so they don't have to go out into their own calendar. They can set it for the same time every single day. And then they get cute little push messages like time to count your little kicker and things like that. So really push with your expectant parents to go ahead and set those daily reminders. They can review kick counting history. They can download that history and share it with their provider. They can upload it to like a My Chart. So it really helps bridge that communication gap there with the provider to say, empowering the mom or expectant parent to say, hey, look, I've been using this app. Have you heard about it? Like, this is my baby's data. I want you to be aware of it. Or just sending it periodically or taking it to their appointment. You can count for single babies or twins. You can track, future pregnancies on the same profile. You can manage multiple devices. So a lot of people like this because I could be counting on my app and then I can be counting on my iPad the next day, or my significant other can log in and see how baby's been moving. So a lot of times at baby shows before COVID, when we used to go to those, we would have significant others come up and say, oh, how can I be part of this? And they absolutely can be part of this. And that's another reason people love it. And it is also available on the Apple smartwatch as well. So you could be lying in bed, resting, 8 months pregnant. You get a ping on your phone that says, oh, time to count your little kicker, or on your watch, and your phone is all the way downstairs, or it's on the dresser and you're 8 months pregnant and you're not going to roll over and get it. You can just count automatically on your watch and it will sync to the app. So another key feature as you're messing around with it, you've probably already encountered this, but one of the things that we added most recently was a strength tracking feature and a notes feature. So if you remember, it's really important to understand the strength of baby's movements, just as important to pay attention to how long it takes baby to get to 10 movements. So after you're done counting, you hit that little footprint. What happens after you get to 10 is you're actually going to see a screen that says, that second image there, it says almost done. Please fill out the following fields to finalize your kick session. And then it says movement strength, and you can click on that I for information. So basically what happens is the user has an opportunity to mark 1 through 5, 1 being very fluttery, very light movements, all the way to fierce. 4 or 5, those strong movements, you feel like a limb is poking out. So they can mark that, and then they're going to see a bar graph. Again, they're going to start to see daily and then the average movement strength. So good visual representation of baby's strength. So the very final screen before they hit finish session is that graph, both graphs together. They see how long it took baby to get to 10 movements on the top with the line graph, and the bar graph, they see the strength of those movements. Now, for example, this baby here, you can see by the chart, it's very visual. It's showing me that baby took a lot longer in that last session, as well as the strength of that movement went down. I'm not saying that these have to correlate. Most times they probably will. But what I'm saying is it's important to pay attention to both. So I could have I can still get the same number of movements, but the strength just feels weak. It doesn't feel normal. That bar graph is going to shoot down, which is going to be a visual cue for me to say, I need to call my provider. I need to share this with my provider and see what's going on. And then along with the care team, they can work together to determine next steps. So that's how the app works. Hopefully you're paying, you downloaded it and you're using it. There's a lot of other key features on there that I want you to use, that I want you to become familiar with. One in particular are these videos. We just added videos to the app. We have a lot of great videos on our YouTube channel, so feel free to check them out, share them. But one thing we did is we added a couple of the key ones that we wanted to share specifically with app users on the app. So you could say, hey, let's download this app and then watch these videos and then let's talk about it. There's not very many. We didn't want to overwhelm users, but there are things like how to use the Count the Kicks app, how to track it, the importance of why we count, some baby safe stories. So absolutely utilize all the resources there. And then in this resources section, you can see on the left-hand menu, if you click on there, what you'll find is a couple different things, but one in particular that I want to bring your attention to is this Find Help resource. So a resource where people can enter their zip code and find free or reduced cost services in their area. So this is kind of constantly building. So if you have a list of free or reduced cost services, or you want to make sure they're on this, you can go and claim your own organization, but you can also send me a list and I can get it to the people that are putting this in the data. We work with Find Help, formerly known as Aunt Bertha, all across the United States. But what's great about this is it hones in their community. And then people can search, I need housing assistance within my zip code. I need a childcare provider that accepts state assistance. You know, they can find that all within this, because if we can connect expectant parents prenatally to resources that they need, we're impacting social determinants of health in a positive way. The chance of that baby experiencing adverse childhood experiences decreases significantly. That's what we want to do. Connecting people to resources prenatally so that they don't have to worry all the time about where they can get help with housing assistance when they have a 2-week-old newborn and their milk is coming in and they're trying to breastfeed, things like that. So another great tool that we wanted to share. And then this video is on our app, but I wanted to share it too because it gives a good overview of how to exactly use the app. Maybe.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
Great. All right. So you have the app downloaded, you know about the data, you know about the research. How do you talk about this? How and why you should talk about this? I know and understand that it can be very difficult to talk about this tragedy, stillbirth, with expectant parents. So maybe you're thinking things like, I don't want to scare moms. And I think it's important to remember that pregnancy is full of risks that we talk to moms about, expectant parents about. And stillbirth is another risk that expectant parents deserve to be educated about. Stillbirth just happens. There's nothing we can do. There can be warning signs if expectant parents know what to look for. Again, a change in baby's movement, a reduction in movement, a change in that movement is one of the first and sometimes only warning signs baby's in distress, which is why the next one is so important. For babies always active, it's not a concern. I guarantee you will get told this when you're talking to expectant parents about this. because I get it all the time when I'm talking to my friends about it who are pregnant and doing presentations to expectant parents, and they say, oh, I don't need to do that. My baby's always active. It's like a jungle gym in there. I never get a moment's peace, things like that. And I always say the exact same thing. I say, that's awesome. A healthy baby is an active baby, but it's still really important to know if your normally active baby has slowed down or changed their movement. You need to know it's normal. So it takes the guesswork out of knowing that. So it takes the guesswork out of knowing if I normally get 10 movements in 5 minutes, or it takes 15 minutes or 20 minutes. I'm not sure because I've never been paying attention. I just know they've moved and I don't know what sort of pattern they're in. So it takes that guesswork because cord and placental accidents can be sudden. Another common one is she's almost at her due date. Actually, the risk of stillbirth increases as a mom approaches or exceeds her due date. So what about talking to somebody who's had a stillbirth previously? You're going to follow the same protocol, but you're going to start talking about it at 26 weeks. If you're not their provider, or you just found out they had a stillbirth, like maybe they mentioned it during an intake meeting or something, feel free to ask questions, acknowledge her child, ask about the name, the gender. If you are her provider or you're a new provider, please read the chart. I know that's a given, but being empathetic, staying away from terms like fetal demise. Ask, has anybody talked to them about the importance of tracking fetal movement before? A lot of people that we've talked to that have had previous live births have stated that when they had their stillbirth, they were never told that they should have been tracking fetal movement. And 9 times out of 10, the femurs that we talked to, I don't know if anybody here is part of fetal infant mortality review, but they've said when they interview moms and families, they say, I noticed reduced fetal movement. I did not know I needed to speak up. Why didn't I know? Why didn't I know that I should have been tracking this? Like, why didn't I know? And so let's turn that why didn't I know to, I'm so glad I was told. I'm so glad my WIC consultant took 5 minutes out of their time with me to talk about this. I'm so glad I saw a poster up in the waiting room of my clinic. I'm so glad I saw a poster in the library. You can put this information anywhere and everywhere. Some other common myths that you might get, again, the active one, I stressed that a couple of times because I guarantee you're going to get it. So it just gives you other talking points. Here's a common one, only those experiencing a high-risk pregnancy should pay attention to their baby's movements. We want every expectant parent to know what's normal for their baby. They should all be tracking their baby's movements, and they should all be educated on count the kicks, not just high-risk pregnancies. My baby should get 10 kicks in 2 hours. 10 and 2, 10 and 1, super common, super easy to remember to say. What's important about this one is that current research indicates moms should work to understand the normal amount of time each day it takes their baby to get to 10 movements. There's a research study on this on our website, but basically what it says is when we focus on a time frame like that, that's all we focus on. So right now you're in a 60-minute presentation, you have 15 minutes left. That's what we're focused on, right? So what this research study showed was basically that's what they focused on. So let's say I'm counting and, normally I get 10 movements in 15 minutes. And one day I counted and it was an hour and 47 minutes took me to get 10 movements. And I think to myself, that's okay because I got it within 2 hours. So it's okay, but it's not okay. That's not my baby's normal. My baby's normal is 15 or 16, 20 minutes, not an hour and 47 minutes. So that's what the research states in my words. I can use a Doppler device. Again, a change of baby's heartbeat is one of the last things to change. That's why when you do go in with a change in fetal movement, providers, nurses, clinicians are not just using a Doppler. They should be doing additional tests. I know there's apps out there that you can get as well. A Doppler should never be used without the guidance of a healthcare provider, and especially to double check things like, oh, baby hasn't been moving, let's check the heart rate. Here's another common one that I hear a lot. I should drink juice. I should eat, a Snickers bar. And what research shows is that kick counts are best monitored without interventions like that. Because if baby's not moving like normal, parents should speak up to their provider. Why are we trying to force baby to move if baby's not moving like normal? It's just like when you and I are sick. We lie there, we sit on the couch, we watch TV. We're not drinking Mountain Dew. We're not eating Snickers. We're not eating chocolate. We're not chugging juice to try to get up and moving again. We're resting. Same with baby. If they can't move for whatever the reason, low amniotic fluid, placenta issues, umbilical cord, they can't move, they're tied, things like that. Whatever the issue, their movements change. They change. That's what's important to understand. Babies kick less near the end of the pregnancy. You'll get this a lot when you work with multi-generational families. They'll say things, oh, baby's just running out of room. You're going to pop any day. As much as we pregnant women love to hear that. While yes, the types of movements do change, it's less of those big rolls. It's more of those like pokes and prods and things like that. Again, if you're still counting, you should still take about the same amount of time to feel 10 movements as normal. Triage doesn't need this count the kicks information. That is the perfect place to have this information. I went to triage 3 times with my daughter for a variety of different things, a couple times because of movement. I did not understand that her normal was 25-30 minutes. She was born well before the app. And so I needed to understand that, and I didn't. So I got checked out every time. Everything looked good. She's now 6 and wonderful. And it would have been great, though, to go home with information and education on how to do this and how I should be tracking baby's movements and understanding what's her normal. So if you are labor and delivery here, or you work with labor and delivery, or you work with your health systems, please share this information with them, show them how to get the materials. And then pregnant people should avoid dental care. I think this is a common one, like especially when you're talking to expectant parents, please still encourage them to go to the dentist like regular. Dentists know how to treat pregnant women, and there's a lot of things that go on with pregnancy and hormones and your teeth, and it's all very interconnected. So making sure that they still go into the dentist. So again, remember to stress the importance of knowing their baby's normal and speaking up, making sure they know who to call if they have a concern, ordering the materials, which we're going to talk about here in a minute. Sharing that research, again, shows evening is usually the best time to count baby's movements, but don't get too hung up on that. Telling mom that the provider should be asking about this too. And if not, empower the mother to, or the expectant parent to ask them about it, to tell them, hey, I'm using this app. Have you heard about it? If you're talking to the expectant parent about it, say things like, tell me about your baby's movements. Can you show me your count the kicks graph? How's tracking your baby's movements going? What questions do you have? Those are all simple things that you can integrate. So other ways to integrate, again, remember that systems change. If you'd like to talk more about this in more detail, specific to your workflow, so maybe you have intake documents that you fill out and they're 12 weeks pregnant, and you can mark that on their document. And then could you put a flag somehow in there that says in, 12 more weeks, you're going to start talking about the importance of tracking fetal movement. You're going to hand them a brochure, or maybe it's a one and done and you don't see them again. Could you just go ahead and give them the brochure, even though they're in their first trimester, and really stress the importance to say, this is what you should be doing in your 3rd trimester. You can download the app now, just start using it in the 3rd trimester. And you have your entire team trained on this. In Iowa, we do the glucose test for the most part in the clinic offices, where we have to sit there and drink it in front of them, and then we wait an hour. If you are a clinician, nurse, and that's how it works in your office, that's a perfect opportunity to say, hey, after you drink this awesome drink, go ahead and read this brochure, download the app, and we'll talk about it. My favorite is the EMR and EHR. So this electronic records. How can you integrate this into your electronic system to have a pop-up that says, oh, Megan's starting her 27th week. Let's go ahead and talk about count the kicks. And then a flag or something on the electronic record to talk about it every single time in the 3rd trimester. Every time you see the expectant parent, you should be asking about this if they're in their 3rd trimester. Another cool idea that we just had from a clinic office that's saying, what if we did a phone recording? So, when we're placed on hold that anybody can listen to, like, why not have one about count the kicks? That's a phenomenal idea. Here's more information on electronic medical records. You can do it. We have gold standard forms that I'll show you in a second. This is baby Margot. Her mom said, I'm very fortunate that my OB office shared the count the kicks information with me through posters on the room walls and a brochure, as it encouraged me to download and regularly use the app, which is how I knew that my baby's normal movement pattern had changed, and now Margot is here. Here's our gold standard. Again, if you are labor and delivery, if you work with the health system, let me know. We can talk through this more. This is a great example of a community-based organization out of Ohio that I wanted to share. They had kind of a one-stop shop where they met with expectant parents They served around like 2,000 primarily Black pregnant women every year. And it's basically a time where they give them all these different resources. So they wanted to make sure they captured information on Count the Kicks and had a reminder in there to talk about it like a script. So we worked with them to create this, and this is what they use for this project that they work with Celebrate One on. So additional resources, this is my second favorite part because I get to play a video of music and I get to have you multitask again. So what I want to do is spend just a couple minutes as we wrap up. So come back, but I want to play this song. And then I want, during this song that I'm playing for just like 2 minutes, I want you to go to our website. You can scan our QR code. And I want you to click on order materials, click on Alabama and order the materials. I want you to get promo posters in English and Spanish, how-to posters, app reminder cards, brochures, and coming soon. So keep your eye out and we'll announce it when it's out there. We're creating picture-based materials. So those that maybe English is not their first language, if you work with a large refugee population, we will have picture-based materials that are in English and Spanish. We'll also have magnets that you can order to hand out to your clients and patients. And then we are working on a pilot project. So if you're a nurse family partnership listening today, I'll be working with you directly on toolkits that will go out to nurse family partnerships. Again, this is a pilot, so stay tuned for more feedback once we gather that and then working with the state health department. But these toolkits are going to include kick counting bands for you to give to those that live in rural areas that maybe Wi-Fi is an issue. They can count using this band on their wrist. It can serve as a reminder. So look for that, more information on that pilot project happening. And again, if you're not at NFP, you can still order all of this material for free. And the NFPs, you can order it too. Just know I'll be sending you a toolkit with some additional information like I just talked about. So as we wrap up, don't leave, but go ahead and order materials because you'll be entered into a draw, win a gift card. But go ahead and order, take a couple minutes. I'm going to turn this on, come back, don't leave. Let's listen to this for a couple minutes and then we'll wrap up.
Sunshine, she's here. You can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Bring me down, can't none bring me down. Your love is too high. Bring me
Okay, so hopefully you took that time to order materials or you're still doing it because I know we can all multitask. Again, these are completely free thanks to our partnership with Alabama Department of Public Health. What you see on your screen is the how-to poster. But we have, like I said, the promo posters, all great to have in your waiting rooms, in your restrooms. If you're out and about in the community, you're going to coalitions, you're driving around, I would highly recommend keeping like a bundle of materials with you. Like I said, libraries can put this up, chambers can put this up. The more touch points, the better. And you guys are our grassroots, right? You're the ones that are going to be implementing this and sharing this in your community. So any place you can share it, the better. And then handing out the brochures and app cards. And then keep an eye out for those new materials that will be coming soon. Another cool thing that we have available for you now is our online CE training is now 2.2 CEs. Anybody can take it in the state, but it's completely free. All you have to do is when you go to register and you use a coupon code called Save Babies -AL for you all. And I will send this in an email after, so you don't have to like quickly write down that long URL, but it goes into a lot more depth of what I'm talking about today. And we added an entire section on equity and inclusion that you can do. So, and that's okay if you ordered some, Amy, I will still include you in the drawing because I know that's awesome that you did that probably when you got this invite. So that's great. And then we have free resources. We have the Parent Academy, Provider Academy. Again, we have those kid counting charts. We have them in English and Spanish. We recently just got them translated as well into Navajo and Swahili too. And then we have video. So take advantage of all that. And then we have our other resource, our Count the Kicks ambassadors, amazing, amazing women, usually all women. Yeah, I don't think we have a man yet. Maybe we will someday, but they're volunteers. They're passionate advocates due to their own personal experiences. Some are lost moms. Some found us, they're birth workers. In your state, Alabama, Jasmine and Amy. Jasmine is a birth worker and very passionate. Amy's a lost mom. So they can come to things in person. They can also go out and drop things off in the community. Sometimes they do trainings with us. They're just fantastic, wonderful women that just volunteer their time to help us with this message. And so you can find more information on them on our website as well on how to contact them, or you can reach out to me. And then why do we do this? Why are you listening today? And why did you listen to me talk for 45, 50 minutes? This is why. All of these baby faces and more. This is not even half of them. These are just some of the reasons why we do what we do, why you do what you do. So we can have more of these baby faces smiling at us. So we can have stories like Nala, who you're going to see today. And again, you're going to remember. These are the stories that you should share with your expectant parents, that you should watch, because this is what you're going to remember. This is why we're doing this. Let's watch.
She came back in after she had me put on the monitor and stuff. And she's like, we're just going to take her. And I'm like, what? And she's like, her heart rate is dropping every time you have a contraction. I was already scared, because I was a high-risk pregnancy. So I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, That was what I lived for, just because I wanted her to, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if? Definitely to pay attention and count the kicks, I feel like it's important just because had I not, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, because your baby might not be here. Just pay attention, seriously, like it's your baby's life.
That's baby Nala. So next steps, obviously become familiar with the app, practice using it. You all already did that because you downloaded it, you ordered materials, so you're set there. Maybe designate somebody in your office to order materials. This takes 3 to 5 minutes to educate. So I don't know all your workflows. I don't know all your systems. If I know a lot of you are parents as teachers. So you might see them several times a month. Like absolutely talk to them about this every time you see them. How is it going? Show me your kick counting chart. What do you know about it? What do you know about Count the Kicks if it's the first time? Making sure everybody knows about this, and then really encouraging your expectant parents, if you're not their provider, to talk to their provider about it. We really want to get OBGYNs, midwives, doulas, everybody involved in this to make sure that everybody in Alabama knows about it. Remember, hours and minutes matter. If you work with people that live in those rural locations, make sure that they're not waiting, like I said, for their clinic to open up the next day, that they need to go in right away. And then follow us. You can share our messaging. You can sign up for our newsletter. And I'm happy to answer any questions. Like I said, this will be sent out to you after either today and tomorrow, everybody that registered. So I just thank you for all that you do. I'm excited for these new products that will be out, this new collateral, thanks to Smil and working with her and the Department of Public Health. And I hope you're excited too. I'm happy to answer any questions. You're all automatically muted. I can unmute you, I think, if you raise your hand, or you can use the chat or Q&A. If there's no questions, that's totally fine too. You're welcome to go. And I got you right at the top of the hour. So we're perfect. So thank you all so much. I'll stay on for a couple minutes in case there's questions. Oh, Rebecca ordered. Awesome. Amy, I'll make sure to mark you down that you ordered a few weeks ago. Thanks, everybody. Sorry, I'm getting over COVID. I can't remember if I mentioned this, so I'm kind of like nasally and cough. And thanks, Catherine, you too. Hi, Smil. Smil was on. Woo-hoo. Yes, thank you, everybody. Awesome. Thanks, Kathy. Oh, awesome, Angela. I'll write you down too. You'll all be in the drawing. Angela and Amy. Thanks, Janie. All right, I'm not seeing any questions. Thanks, Megan.